I'm Dr. Stephen Atchison of Orthopedic Specialists here in Shreveport, Louisiana. I'm a total joint specialist, primarily emphasizing total hip and total knee replacements, including partial knee replacements. So Mako is a commercially coined name that represents a robotic system that was first introduced back around 2008. We were one of the first people in the country in 2010 to adopt this technology, and the first in the state of Louisiana to bring the technology here to start utilizing it for our joint replacements. I probably think there are a lot of factors that have led to patients getting better quicker. It's anesthesia, it's the robot, it's our technique, it's our experience, but I think probably the number one thing that has changed our patients' experience more than anything is our emphasis on pre-surgical education. I think all of orthopedics and joint replacements especially are going to continue to move to an outpatient setting. You know, more and more of our patients now are being, kept in the hospital overnight, and most of all of them are going home in the next morning. 10 years ago, probably the average hospital stay was 3 to 5 days. Now the average hospital stay is probably on the order of 24 to 26 hours. And certainly many people can be done outpatient. Certainly the older patient population probably needs to stay in the hospital, but the younger population, certainly a significant portion of them, if they have the right social structure and help at home, could be done as an outpatient. But everything is moving to sooner and sooner discharge from the hospital. I mean, I have a lot of 80-year-olds that are easily able to go home the next day and are wanting to go home and are waiting for me to see them the next morning so they can go home. And 10 years ago, they were staying for 3 or 4 days. So a lot has improved. Robotics is a part of that. That has driven it. A lot of it's anesthesia and our perioperative care of the patient that has allowed them and education has allowed the patient to go home sooner. You got to let them know what you're going to do, how you're going to do it, and what's expected of them. The more educated the patient is in understanding what it is that you expect, what it is that you're going to deliver, and what it is you expect from them, the better they're going to do. Surgery is the easy part. On an average total knee replacement, the patient's in the operating room less than an hour. What then takes place afterwards on their own at home every day is where they win or lose. And so again, we can do a great operation, and if they don't put the time in when they go home, it's not likely to be successful. And so we really try to make sure that we're operating on people that are motivated, that are going to do what they need to do to get themselves better. And it's our job just to let them know what's expected, because if they don't know, they're not going to do it.